Listen to me very slowly and very carefully on this. After more than 20 years working in medicine, watching thousands of people walk into hospitals hoping to get checked for peace of mind, I've come to realize a truth that has troubled even me for many years. Sometimes, the most dangerous thing you can do for your health after the age of 60 is to undergo too many tests. It sounds contrary to everything you've ever been taught, doesn't it? We are always told that early detection saves lives, that the more we test, the more we can control disease, that a normal result will bring reassurance. But there is a part of the story that very few people talk about, the part that happens after something is found, even when you have no symptoms at all. Imagine you are 65. You still take your morning walks, still drive yourself to the market, still laugh and chat with your grandchildren. One day, you decide to get a full checkup, just to be safe. A few days later, the doctor mentions a small spot, a slightly abnormal number, an area that needs monitoring. It doesn't sound serious. But from that very moment, your life begins to change. You lose sleep. You search the internet. You return to the hospital. Then comes another test, then another procedure, then another worry. And the most heartbreaking part is this. In many cases, what was discovered would never have caused harm if it had never been found. It is like wrinkles inside the body, signs of time, not signs of disease. But once it is written into your medical record, it becomes a problem that must be addressed, and the medical wheel begins to turn. I have seen people walk into clinics in good health and walk out with the mindset of a patient. I have seen unnecessary surgeries, avoidable complications, months of living in fear, all beginning with a test that seemed completely harmless. So the important question you need to ask yourself today is this. Are there tests that sound very smart, very modern, but may actually cause more harm than benefit after the age of 60? And to truly understand that, you first need to learn about a phenomenon in medicine that, once you see it, you can never unsee it again. This phenomenon is called the medical domino effect, or in professional terms, what we refer to as the Cascade effect. And believe me, once you understand how it works, you will begin to look at every recommendation for testing in a completely different way. Imagine a long row of dominoes carefully lined up. Everything remains calm until the very first piece is lightly touched. Just a tiny nudge, but then you already know what happens next. One by one, they begin to fall. Faster, harder, impossible to stop. In medicine, after the age of 60, a test done just to be safe is often that very first domino. You go for a checkup while feeling perfectly fine. The results come back with a simple note. Further monitoring is recommended. That's all, not cancer, not a serious disease. Just a faint shadow, a slightly abnormal number, a tiny lump measuring a few millimeters. But from that very second, your mind is no longer the same. A cautious doctor will refer you to a specialist. The specialist will suggest a more detailed test, more advanced machines, clearer images. Yet the clearer things become, the more unusual findings seem to appear. And then the frightening phrase emerges, "We should do a biopsy to be sure." A biopsy is not a small matter. It means a needle entering tissue, anesthesia, the risk of infection, bleeding, pain. Sometimes hospitalization is required. Sometimes complications must be monitored. And all of this happens only for you to finally be told. Fortunately, it's nothing serious. That may sound like relief. But pause for a moment. How many weeks of anxiety have you endured? How many trips back and forth? How much money has been spent? How many sleepless nights imagining the worst? And in some cases, the procedure itself creates real complications. Something you never had before the test was done. The irony is that many incidental findings in people over 60 are simply normal signs of aging. Small cysts, calcified spots, structural tissue changes, like gray hair or wrinkles. If they were never looked for, they would remain there for the rest of your life without ever bothering you. But once they appear on a medical report, they suddenly become a problem that needs to be managed. And so the domino chain continues. More medications, more follow-up visits, more patient labels. Gradually, someone who was once healthy begins to live like a sick person. They limit their movement. They become afraid to travel. They lose confidence in their own body. Quality of life declines quietly, but profoundly. Understanding this domino effect is the key to avoiding medical decisions driven purely by fear. Because when you recognize how a small test can trigger an entire chain of unnecessary interventions, you will begin to ask a more important question. Which specific tests are most often the most dangerous first domino after the age of 60? And the first domino I have seen pull so many people over the age of 60 into a spiral of anxiety is the full-body scanning packages that sound incredibly smart and modern. You have probably seen the advertisements. Just 30 minutes. Scan from head to toe. Detect every hidden risk. It sounds irresistible. Who wouldn't want to know exactly what is happening inside their body? Who wouldn't want to stay one step ahead of disease? But the reality behind that curtain of technology is often very different from what people imagine. Picture yourself at 67, still active, without significant pain or discomfort. You decide to undergo a full-body MRI or CT scan for peace of mind. The results come back with a small line in the report, a 3 millimeter lung nodule, a tiny kidney cyst, a faint spot on the liver. Not dangerous right now, but follow-up imaging is recommended in 3 to 6 months. Just a single sentence like that, and the calm in your mind begins to disappear. Every time you cough lightly, you think about the lung nodule. Every brief backache reminds you of the kidney cyst. You start living in a state of waiting for the next scan, waiting for answers, waiting for something you did not even know existed before. What is important to understand is that research shows when full-body scans are performed on healthy people over 60, almost everyone has at least one abnormal finding. Not because they are developing a dangerous illness, but because the body has lived through 6 or 7 decades. Small changes accumulate over time. This is completely natural. Yet once these changes appear on a screen, they immediately become targets for medical intervention. The dominoes begin to fall again. Repeat imaging, specialist consultations, biopsies, even surgery, only for many people to reach the end of that path and be told it was all a false alarm. The second type of domino is more subtle because it touches a deeper fear, the fear of losing memory. As you move into your 70s, forgetting an actor's name or walking into a room and forgetting why you came is extremely common. But when family members worry, when you hear more about Alzheimer's disease, a suggestion for a brain MRI may arise. A few days later, you read phrases such as mild age-related brain atrophy, white matter changes, or small vessel disease. These words can feel like a verdict. Yet the truth is that more than 90% of healthy people at that age show similar findings on imaging. The brain ages just as the skin ages. But once people see it on a scan, many begin to believe they are already declining. The irony is that someone with a very abnormal-looking MRI may still read books, manage finances, and live independently. Meanwhile, another person with relatively normal imaging may experience real memory difficulties. Images do not always reflect function, and that is exactly why you need to be extremely cautious with tests that sound logical but can easily trigger the domino chain. However, the story does not end there, because there are even more familiar screenings that can push older adults toward invasive procedures they never truly needed. And one of the next most dangerous dominoes comes from something many people believe is the symbol of smart prevention: the cardiac stress test. It sounds perfectly reasonable. The heart is a vital organ. Risk increases with age. So checking early must be the right thing to do, shouldn't it? Imagine you are 72 preparing for a minor procedure, perhaps a knee replacement or hernia repair. You still walk every day, climb stairs without difficulty, have no chest pain, no shortness of breath. Yet as part of routine protocol, the hospital suggests a treadmill stress test, not because you have symptoms, but simply because you have passed a certain age milestone. You step onto the treadmill. Your heart beats faster. Your legs grow tired. The screen displays lines of electrical activity. A few days later, the doctor tells you the result is somewhat suspicious. Not a confirmed diagnosis, just uncertainty. But you already know what comes next. You are referred for coronary angiography. A catheter is threaded through an artery, all the way to your heart. It may sound straightforward on paper, but it is a truly invasive procedure. There is a risk of bleeding, minor stroke, arrhythmia. And in many cases, when the images appear, the doctor sees only mild plaque build-up, something almost unavoidable in your 70s. No stent is needed. No surgery is required. Yet you have crossed an important psychological boundary. From being someone who played tennis, traveled, tended a garden, you begin to think of yourself as a heart patient. You become afraid of exertion. You limit your activity. And paradoxically, that very fear can weaken your heart faster than any plaque ever could. Then comes one of the most debated dominoes of all, screening colonoscopy after the age of 75. This is a wonderful tool at 50, 60, even in the early 70s. It helps detect and remove polyps before they turn into cancer. But as age advances, the balance between benefit and risk begins to shift. The preparation process can lead to dehydration and weakness in older adults. Sedation may cause confusion or affect breathing. And what concerns many physicians most is the risk of bowel perforation, a rare but serious complication that can lead to emergency surgery and even the loss of independent living. Meanwhile, the benefit of screening is the prevention of a disease that often takes 5 to 10 years to develop. If life expectancy is no longer very long, the immediate risks may sometimes outweigh the potential future benefit. The key is not to neglect your health, but to move towards smarter monitoring, paying attention to warning symptoms, maintaining a fiber-rich diet, keeping the digestive system healthy. Preventing disease through lifestyle can sometimes be more powerful than any device. And when you step back and look at all these dominoes, from the heart to the colon, a bigger question begins to emerge more clearly than ever before. After the age of 60, what truly determines whether you live longer and live well? And this is the crucial point that many people only realize after countless trips in and out of hospitals. Health after the age of 60 is not measured by the number of tests you undergo, but by the way you live each day. Ask yourself honestly, can you stand up from a chair without using your hands? Can you walk a few blocks without getting short of breath? Do you sleep deeply and wake up feeling energized? Do you still remember important appointments, manage your own finances, laugh and talk comfortably with your grandchildren? These are the real vital signs of healthy aging. Not a cholesterol number that is a few points lower, not a perfectly clean MRI image. Throughout many years of medical practice, I've met people whose test results were so impressive they seemed enviable. Yet they lived in fear, limited their movement, and became socially isolated. I've also met older men and women who had a few abnormalities on paper, but still gardened, traveled, read books, and truly enjoyed each day. Medicine can provide information, but you are the one who decides how to live with that information. So from today onward, whenever a test is recommended, do not simply nod out of habit. Pause and ask. Ask clearly, what is the purpose of this test? If something is found, what will the next step be? What are the risks of those steps? Are there less invasive options? And most importantly, will this result truly help me live better? After 60, the greatest priority should shift from hunting for disease to protecting function and independence. Maintain muscle strength to prevent falls, preserve social connections to protect the brain, eat wisely to support the immune system, sleep enough to allow the body to repair itself. These seemingly simple actions are actually the most powerful foundation for extending a healthy lifespan. Because the real goal is not merely to add a few more years spent waiting for the next test. The goal is to live those years with dignity, with freedom, with joy. To step outside whenever you wish. To hug your grandchildren without fear of pain. To wake up each morning with the feeling that you are still in charge of your own life. If today's message has helped you see medicine from a different perspective, I hope you will help share it. Please subscribe to the channel and turn on the notification bell so you do not miss upcoming videos, where we will continue to speak honestly and openly about aging health and about smart choices that help you live longer and, more importantly, live better. And I would truly love to hear your story. Have you ever felt caught in a test or procedure that, looking back, seemed unnecessary? Share your experience in the comments. Your real-life insight may help someone else make a wiser decision.